Lots of reaction to the Ford government's announcement that will see the province try to tackle hospital wait times and surgical backlogs by shifting some services to for-profit facilities. So joining us live now is registered nurse and health equity advocate Amie Archibald-Varley. Amie, thank you so much for joining us. Good morning.
Good morning. Thanks for having me.
I'll start off by your take on this. What did you think of the announcement? We know it was a couple of days in the making. There were rumors, but once the details were official, what did you think?
It was not terribly surprising, but unfortunately, this is the direction that we need to be concerned about with healthcare. I was surprised that we still aren't dealing with the human resources issue, where there are over 25,000 nurses, ONA stated, that need to be in the work field. And again, we should be concerned about this kind of expanding scope. I think that, we do need to see some changes within our healthcare system, but I don't know if this is the right direction. Even some of the surgeries they mentioned, physicians have been saying that those surgeries should be left in the hospital systems.
Right, and saying that often if the clinics are not connected to hospitals, that can lead to more serious injury or possibly death in some cases. And so there is this concern about understaffing, as you mentioned. The staff that are already in place in hospitals, do you feel like the proposed plan now will have a lot of those staff members start to go into the private sector?
I wholeheartedly believe so. And I think this is where, people talk about the whole concern about money talks. Right now, nurses are being taken to court by the Ontario government, which is insane. We won our bill 124, and the government is still taking us to court. And I believe that what will happen is people will trickle down from the public sector to the private sector, whether it's because of pay, whether it's because of better hours. They may leave. And lots of nurses have messaged me saying that they might leave as well. And again, that's only going to leave the public sector in more of a crisis than it already is.
And for the public system itself, how do you think these changes will impact just equity in general? I know you deal with health equity on a regular basis as well. What's the impact do you believe or foresee could happen with this?
When we're talking about health equity, we're talking about equal and equitable access to healthcare for all people. And we know through COVID-19 and various other things that we've seen the disparities within certain racialized groups and populations. This will only further that gap. And it's not even just for people that are racialized. It could be people that have disability. We're going to see ableism within the system. It's very concerning. And I always ask these questions, and I want people at home who are thinking about this to ask these questions as well. Who stands to benefit? Who is going to lose? Will the system gain supports for everybody? Who will be left out? Who will be hurt the most? Those are the questions that we should be asking when it comes to healthcare. And if this is the direction we're moving, it's not going to be an equitable one.
Now, the province does say that the people who will benefit will be those people on this lengthy wait list waiting for a lot of these surgeries. What do you think then should happen in order to get that backlog dealt with as soon as possible?
I think it's important that we look at different strategies. I've always wondered, why does it have to be private? Why can't these facilities be public? Why can't we make two more public healthcare facilities where we can, allocate resources to support individuals? I just question the motives that we're having right now with the Ford government, where they walked back on things like saying, we're not going to touch the green belt, and then they're touching the green belt. I'm concerned that, it's going to go from we're not paying with our OHIP card to we are paying with our OHIP card. And I think people have to understand that we will have to pay for the profits of the margins for these private clinics. And it's just very concerning to me, the direction that we're taking. I think that we're going to have to start asking ourselves some hard questions in terms of the healthcare that we want to see as Canadians, as Ontarians.
Okay, Amie Archibald-Varley, thank you so much for joining us this morning. Really do appreciate it.
Thank you for having me.
No